All right, so my patient today is a 15-year-old female lacrosse player. She presents with anterior knee pain. She has notable poor knee control and valgus movements whenever she is squatting or landing, jumping or landing, so we're gonna work on those right now. So for the first exercise in this progression, I've got her doing clamshells. So I've got her in sideline position with her knees and with her feet, knees, and hips stacked. And I'm gonna ask you to push your knee forward a little bit into my hand. Keeping that forward movement, I want you to lift your knee up towards the ceiling. Very good. So for the clamshells, we'll do 3 sets of 12 for 3 days a week. The next exercise I have her doing are squats with the resistance band. So this will help promote anti-valgus movements. So she's gonna go into a squat, keeping those knees pushed out against the resistance, helping to promote that movement. And then to help with the valgus while sitting and landing and jumping, we're going to do box jumps with the resistance band as well. So that way she can work on keeping her knees out while she does this movement. And for those, we'll do 3 sets of 8, 3 days a week. Now for the next exercise progression, we're going to be working on the patellofemoral pain syndrome, and that addresses muscles above and below the joint, as well as combining those movements as well. So the first exercise will be below the joint of the knee, so I'll have her do calf raises. She's going to do one leg at a time. For calf raises, she'll do 3 sets of 15, 3 times a week, 1 on each side. And then now we'll work on the joint above. So I'll have this resistance band back on. And we'll be doing the hip series. So she's gonna go into hip flexion, she's gonna go into hip abduction, and a hip extension, working all 3 planes of the hip. That way we have nice motor control of the joint above the knee. So she's gonna keep her knees straight as she does this. She's gonna keep her hips facing forward the whole time. Very good. She's gonna do 3 sets of 10, 3 times a week. And then the last exercise, and this one is gonna be putting it all together, we'll be doing plyometric step-ups. So she's gonna be using the box for this. She's going to step up and explode at the top, clearing some distance off the step, and then come back down in a soft landing. And that is the exercise progression.